and may they serve as an inspiration for all. So I invite our first speaker, Dr. Lekha ma'am, who is a consultant medical retina and cataract surgeon at Giridhara Institute, Cochin. Over to you, Lekha ma'am.
Good afternoon to all of you, and thank you, Dr. Divya, for giving me this very different experience. So, this most unplanned and a very ordinary journey started with something called as blessing, which was my entry into Shankaranetralaya for DNB training. And the intensive and excellent 3 years of training that followed taught me what it really means by comprehensive eye care. But that was also a period which molded not only the clinician in me, but also the person. And eventually, it was also the beginning of my medical retina career, which was offered to me by our chief, late Dr. S.S. Badrinath. So as I said, retina was actually not completely my choice. It was one of the options. In fact, it was more offered to me. The reason because I had fear, because of the vastness of the subject and also the low confidence level I had at that time. I'm sure some of the beginners also must be going through the same phase. But slowly I could improve with the guidance of my excellent teachers and the support of my seniors and friends. So at Shankaranetralaya, the main stress was learning proper clinical evaluation, especially doing good indirect ophthalmoscopy with scleral depression. And I would say anybody planning to pursue retina, this is the first thing that you should master. And you should also learn good documentation, because only when you document your lesions, you're understanding it in all its dimensions. We were also taught optimal use of investigations, which is integral to any retina practice. The main modality at that time was laser, but I also learned very valuable lessons in dealing with patients and managing their expectations. After that, I had opportunity to work in various situations, and I'm sharing that so that at least some of you in similar setup can sort of relate to it. So it started off at Shankaranetralaya, where I was part of an expert team. I had help for everything. Learning curve was very fast, and I'm telling you, to those in such institution, utilize all the facilities you are getting there, because you may not easily get it outside, but be prepared for a rigorous schedule. Then I had to move on to a corporate hospital where it was like a solo performance. The main part of that is you do your decision making all yourself, and slowly you will become a kind of posterior segment specialist, because everything behind the lens is sent to you. So your experience in UVA, neuro-ophthalmology, everything improves. I also had an opportunity to work in a charity hospital that was mainly to improve my cataract surgical skills. And I would say this combination of cataract with medical retina is something which can enable you to adapt into any kind of small to medium scale setups. And if you have if you are interested in teaching, another option would be to work in a medical college or in a multi-speciality hospital with training programs. And here, another advantage is the interaction you get to with the specialists of the other departments. And for me, during that period, I was comparatively getting more spare time, which I utilized it for publications, and that helped me to keep motivated. So after all this, now at Giridhara Institute since the last few years, I'm extremely happy, because to me it is an extension of Shankaranetralaya, and I feel my life has come a full circle. Here I'm getting an excellent mix of good quality retina practice, good infrastructure, a motivated team to work with, and opportunities for continuous learning, and above all, an encouraging and supporting team leader in Dr. Giridhar. So as I look back, it has been a paradigm shift in retina practice. What started off with very limited investigations and laser as a main modality of treatment in the early 90s was revolutionized with the advent of OCT and anti-VEGF injections. And I would say this is the main thing that has made medical retina practice much more fascinating and enjoyable. And this can really be divided into pre and post anti-VEGF era, and that has made all the difference in medical retina. This was followed by a proliferation of many new imaging systems, so that we are seeing retina in much more precision and detail, not only newer anti-VEGFs, but also many changes in lasers and even technological advances like artificial intelligence. And as we survive the pandemic and move on, we can see the invasion of online platforms in every aspect. More anti-VEGFs are continuing to come, and we are understanding the importance of genetics, and very soon we may have treatment for many untreatable, so-called untreatable diseases, including inherited retinal disorders. So the landscape of medical retina is really changing with all the advances that is happening, especially in the field of imaging. We have a more deeper understanding of many retinal diseases. Newer diseases are getting prescribed. We have more precise treatment strategies, and next game changer could very well be the gene therapy. So all this has created an increasing demand. As we all know, the diabetics are increasing, also aging population on one side and more preterms on the other side. We have more imaging modalities, so we need more trained manpower, and also the increased workload because of the frequent treatment that we need to do. For this, we also have to increase the supply, and as practicing retina specialist, I feel it is our responsibility to motivate and train the youngsters, and these are the fellowship opportunities available at Giridhar, and for opportunities elsewhere you can refer to any edition of IJO. It's important that you have some of these attributes as you pursue your career, most important being an interest or passion for the field you're working in, focused, hardworking, dedicated. You should have patience because most of our patients require lifelong care, unlike cataract, which is a one-time intervention. You need to adapt to circumstances because retina is a specialty which needs a lot of infrastructure, and the place where you're working may or may not have it, but utilize whatever is available. Have good communication skills to establish rapport with your patients, and my philosophy has been cure if possible, otherwise at least care for your patients. Compete, but with yourself. Never compare with your surgical colleagues because their work is at a different level. Instead, be a team player. Have your monetary priorities clear and have a positive work-life balance. So these are some of the views of my colleagues in the same field but in different setups. So this person had a fascination for retina and decided to pursue it. There's another friend after the retina, she's working in a predominant cataract setup, but she feels she says that she can do a lot of help to her colleagues for pre and post-op evaluation, her ROP work, all that. She is very confident, and there's a budding specialist who says believe and be kind. So as my journey continues, I'm immensely grateful, and I think it was a privilege to take care of babies from few 100 grams to those in 80 plus, 90 plus, and I look forward to a lot of hope. And I'll continue to understand the dream of this great visionary and will continue my efforts to carry his legacy forward. So this is my message to all the youngsters. The path from dreams to success does exist. May you have the vision to find it, the courage to get onto it, and the perseverance to follow it. Thank you.
Thank you, ma'am, for sharing your life experience. So, thank you, ma'am.